We're going to talk about pain assessment and reassessment. We had a DNV finding in September where we received a nonconformity finding related to pain assessment and reassessment throughout our organization. Numerous charts that we reviewed did not demonstrate assessment prior to administration of pain medications and or reassessment of the patient's response following the administration of pain. This NC1 finding requires us to identify actions needed to correct the process, develop and submit a corrective action plan, implement the corrective action plan within 60 days, and provide evidence of improvement. So we are providing education regarding best practices, and then managers are looking at monthly reports that will reflect this compliance rate. We will be following up on the data and following up with nurses one-on-one for a goal for nursing staff to achieve 90% compliance with assessing pain and sedation level prior to administering pain medications and within 60 minutes after medication within 90 days of this education. So the procedure we're working off is called pain management for the adult and pediatric. This training is just for inpatients. ED has their own training. And so a few things that I've highlighted here. This is our procedure, and one of the things that DNV does is they want to make sure that you are working off of what you say you're doing. And so in an inpatient setting, we need to assess prior to administering pain medications. We're also assessing the time of admission to the facility, which includes that pain goal level and any chronic pain. ED has their own procedure. There's procedures here or steps here for ambulatory settings. Prior to every pain medication administration, the nurse will document pain score, sedation level when administering opioids that may cause sedation, and then the location orientation of that pain. Reassessment should happen within 60 minutes of any intervention or as indicated per individual unit policy. Documentation guidelines, we should always document the results of all assessments using appropriate documentation flow sheet rows. I love our guiding principles. Patients have a right to appropriate pain management. Pain will be assessed using a population-specific pain assessment tool with appropriately determined mild, moderate, and severe pain intensity indicators, which are listed here. 0 is none, 1 to 3 mild, 4 to 6 moderate, and 7 to 10 severe. All right, so pain is pretty much an assessment done by RNs and LPNs, although we do ask the PCPs report that to the nurse if they hear about pain. Obviously, that's one of our 4 Ps. We ask that you assess on admission, so including the pain level, acceptable pain level, with every head-to-toe assessment, with every pain medication. That thing must be a number. So one of the things that the report doesn't pull is it doesn't pull if you use this verbal rating pain scale. So the safest thing to do is to always just put in a number, even if it's the same. It's so much easier just to check that box. Even if you're putting in the same number, if you're not sure which pain scale you use, just go ahead and put a number in here in your MAR. The pain assessment includes a pain number on pain medications like Dilaudid that are given for other reasons such as air hunger. So the report can't differentiate, so it's really just safer to assess and reassess all pain medications regardless of the intention and regardless of whether the patient is comfort care. You need to reassess within 60 minutes of the pain medication, even if it's scheduled medication. If you gave that medication, so say you're the UC or you're at the end of your shift, it does fall back on you if that reassessment isn't done. So making sure you're following up on any pain medication you gave just to make sure that reassessment was done. I suggest if you're giving meds close to shift change that you're reassessing doing bedside shift report. If you use the verbal pain rating score again, so here's our options for adults in EPIC, number, word, CPOT, basis, FLAC, and pain ad. If you're going to use that verbal rating score, just know that that does not pull into the report yet. Hopefully it will shortly. It's a new assessment that EPIC added and we didn't know about it, and so it wasn't built into that report. So please, if you're going to use those, pull in a new number into your MAR, and for reassessment, make sure you're doing response to pain interventions. So what will satisfy the report is any number that's not charted in something like verbal pain rating, and then anything in this response to pain interventions. All those count. in terms of your reassessment within 60 minutes. So we've been talking about this report, and I'm going to show you a picture of it. The report is looking at all meds except for Tylenol, because we know we give a ton of Tylenol for fever, and it's also not looking at fentanyl boluses. We're looking for a number score given on administration, and again, it's not pulling that verbal rating pain scale in, and that a response was assessed and documented within 60 minutes of administration, so either the number or the response to pain intervention. And again, I know I'm beating a dead horse, it doesn't see that verbal rating pain scale. So here is a picture of what the managers are getting every month. So I've blocked out the names because that's nobody's business but theirs. But we see a list of employees. We see the first column is the number of pain medications you've done all of your charting on. So they've had both a pre and a post. And then the next one is just the pre, and one is just the post. One is none, so that fourth column is none. And the fifth column is the number of medications given. So if you only give 1 or 2 medications and you missed one, that's going to skew your whole response. It also shows it for any person who's worked on that unit. So if you are typically a 4 West Ops nurse and you float to 5, you'll also show up on the 5 list. It's kind of hard, but your report from your manager will just show the administrations you gave on 4. But float pool staff are trying to pull all of the data from all the different floors so we can kind of see what's going on. The second column that has a percentage is that percentage score. So based on this first number into the second number, so this person gave 49 administrations, and for 46, they did both of the pieces of required documentation. That gave them a score of almost 94%. Again, we're looking to be at least 90% compliant overall in the space of a few months. A couple tips and tricks to make sure that you have documented and reassessed, especially for the reassessment, is one, to use the nurse brain. So looking at the nurse brain for those pain reassessment due. What it won't tell you, it'll satisfy it if you use the verbal pain score. So the Epic doesn't know what our report's running. And so if you get a check mark off of here and you use the verbal and you don't get credit somewhere else, that can be problematic. You can also add to patient list that pain reassessment due. So you would go to your patient list, click on the heading of the patient list, go to properties, and you can add something called pain reassessment due, and it will show you when your pain reassessments are due and if you have any overdues. Thank you so much for your commitment to caring for patients at Sentara RMH and helping us to make sure that our patients have their pain assessed appropriately and that pain is reassessed appropriately.